everyone. Welcome to the Happy Flosser podcast. This is the podcast that helps dental hygiene students feel calmer, smarter, and maybe a little more confident, one episode at a time. My name is Billie, your dental hygiene educator, your cheerleader, and your guide through all of the wild, weird, and wonderful things that happen in the oral cavity. Today, we're going to dive into something that students always ask me about: periodontal pathogens. These are the microbes that show up again and again in our textbooks, in our board prep questions, in clinical conversations. And once you understand who these guys are and what they do, perio suddenly becomes a lot less mysterious. I'm also going to give you mnemonic memory tricks for each of these pathogens so that it makes it easier for you to pull them out of your memory bank when you're taking a test. So even if you're in the clinical setting with a patient, or if you're taking an exam, maybe in your perio class or one of your clinical courses, you're able to pull and recall those pathogens out of your memory bank when you are needing to, or when you're explaining perio to a patient. Sometimes it's nice to be able to actually tell the patient the name of the pathogen and kind of how it connects the dots for the patients. We all know that we have to judge how we treat the patient and how we have conversations with the patient based on the questions that they ask. So we want to be prepared with the type of information that they need. And some patients actually want to know the gory details. All right, so let's get started. Porphyromonas gingivalis, right? P. gingivalis. That one's, we have to start with that one, don't we? That is the puppet master. So if you remember only one microbe from this episode, let it be this one, okay? P. gingivalis is what we call the keystone pathogen, meaning that even in small numbers, it can really disrupt the entire microbial community and then shift the mouth toward disease. And the reason why it's dangerous is because it produces gingivanes, which are powerful protease components that break down the host tissue. Sorry, I do get a little tongue-tied when I'm talking about these words, guys, so you're just going to have to bear with me. It manipulates the immune system, right? Not by overpowering it, by confusing it. So the other claim to fame for the puppet master, P. gingivalis, is that it really works beautifully with other pathogens, especially some of the other ones that we're going to talk about. Treponema denticola. So here's how I want you to remember Porphyromonas gingivalis. Think P. gingivalis as the puppet master. It pulls the strings, it changes the environment, and lets the other pathogens thrive. When you picture it in this way, it'll make it easier for you to remember that it doesn't need high numbers to create chaos in the oral cavity. It really is in control of the inflammatory response, and it sets the stage for chronic periodontitis to take hold. Something that you could share with your patient, you could say something like, "Some bacteria act like troublemakers, but this one is more like a mastermind. It changes the whole neighborhood." That makes sense to a patient if you are doing saliva testing and P. gingivalis shows up in that patient's scene. Now let's talk about Tannarella forsythia. So a mnemonic, Tannarella wears a tutu. She's fancy, but fragile. So when we think of Tannarella forsythia, which is another member of the famous red complex, it's sneaky, but it's not as famous as P. gingivalis, but it's strongly associated with deeper pockets and rapid attachment loss. So the virulent highlights of Tannarella forsythia is that it has a unique surface layer, 5 layers to be precise, that really helps it attach and invade the tissue. It produces proteolytic enzymes that break down the tissue, and it thrives in anaerobic, inflamed environments. Does this sound like the perfect space where periodontal disease is taking shape? It sure is. So for you guys, for your memory trick, I want you to picture Tannarella in a tutu. She's delicate, she's high maintenance, and only shows up in very specific environments: deep anaerobic pockets. This will really help you remember that it's associated with advanced disease and it's part of the red complex trio and it's fastidious. Okay, that is your little Tannerella forsythia wearing a tutu. Hopefully that helps you. And then there's Treponema denticola. So talking about the spirochete superstar, that's pretty much Treponema denticola. So it's highly motile. It moves like a corkscrew, which allows it to penetrate tissues and travel deeper than many of the other bacteria that we talk about. Dentillicin is a protease that destroys host proteins, the motility that enhances tissue invasions, and it's synergetic with P. gingivalis. They literally help each other survive. They're like the dynamic duo. So what I want you to think of when you think of Treponema denticola is a twisty tornado. It spins, it drills, it burrows. This really will help you remember that it's a spirochete, it's highly invasive, and it's associated with advanced periodontal destruction. So when you see deep bleeding pockets with tissue breakdown, treponema is often part of the microbial party that's going on to cause this display for your patients. Now, sometimes just by having good concrete foundational knowledge about these different pathogens, you don't necessarily need to do a saliva test to know which pathogens are most likely present on this patient. Just knowing how the treponema invades the tissue, if you see those deep periodontal pockets with the bleeding, you can probably guess that there's something going on there that involves that pathogen. All right, the next one I want to talk about is Agrobacter actinomyces sedicomitans. And I might get somebody texting me saying that I didn't say that right. So we basically call it AA. I gave it my best shot. I don't think I've ever been able to adequately say that entire word, and I apologize. And I know there's a couple superstars out there. I know that Shelley, the hygienist, can totally say this word. It just rolls off of her tongue, and I'm totally envious of that. So what I want you to know, AA, it's attack, okay? So AA is the pathogen. Literally, it's a mouthful, right? Literally and figuratively. So if I've made that pathogen sound like a mouthful, then I've done my job here. It's really the pathogen that's most famously associated with aggressive periodontitis, now called grade C periodontitis. All right. It is not just destructive, it's fast acting. It's the pathogen that you think about when you see rapid bone loss, younger patients with perio, localized first molar or incisor patterns of crestal bone loss. We know that AA is involved in this type of early destruction and rapid progression of periodontal disease. When we look at the leukotoxin, we know that it kills white blood cells. These are the virulent highlights of this particular pathogen. It's a cytolethal distending toxin. It disrupts the cell division, and the ability for it to invade epithelial and connective tissue is pretty significant. So here's your memory trick for this little guy, the mouthful, literally and figuratively. Attack. AA is attack. It attacks the immune system. It attacks the tissues. It attacks everything and attacks quickly. It's really linked to rapid progression. It's aggressive. So attack, aggressive, right? It's clinically significant even in low numbers. So when you see that rapid progression periodontitis where you're not able to gain control and get ahead of the progression of the disease, you know that this pathogen is probably involved at some level. All right, Fusobacterium nucleatum. All right, this is the bridge builder. It's our final pathogen that I'm going to talk about in this episode. It's ultimately bridging organisms. So the Fusobacterium connects early colonizers. It allows the biofilm to mature and become more pathogenic. It really helps it stick to the host cell and other bacteria. It promotes inflammation. It's abundant in periodontal pockets. So what I want you to think of is Fuso is the bridge builder. It fuses. It literally links the biofilm community together. It's the connector. It's essential for biofilm maturation, and it really plays a role in both health and disease. All right, so let's recap with a quick mnemonic set for those of you that learn well with that. P. gingivalis is your puppet master. It controls the immune system and sets the stage for disease. Tannarella forsythia, the tutu tannarella. It's fastidious, it's fragile, and it's found in your deep pockets. Treponema denticola is your twisty tornado. It's motile, it's invasive, and it's incredibly destructive. AA, attack, attack, you have the rapid aggressive bone loss, you have the leukotoxin, and you have aggressive disease as a result of the presence of this pathogen. And then Fusobacterium nucleatum is the bridge builder. It connects early and late colonizers together. So if you can remember these 5 characteristics and their personalities, periomicrobiology becomes so much easier for you to understand and so much easier for you to have communication with your patient. So if this episode made you feel a little more confident about periodontal pathogens, I'm really glad. That's the whole mission of the Happy Flosser podcast here, is to make learning feel a little bit lighter, a little more clear, and a little more doable. And if you want tools to help you study these microbes visually, like comparison charts, flashcards, or printable study sheets, you can find those on my Etsy shop and my TikTok store. They are really designed to make the hard stuff feel a little more manageable. You guys are doing amazing. Keep going, keep learning, and I will see you in the next episode. Have a great week.